This is a tutorial on how to conduct a full head-to-toe assessment for LPN students. In this video, we will cover how to assess neurologic, musculoskeletal, cardiovascular, respiratory, GI, GU, and integumentary systems. Before entering a patient's room and beginning your assessment, you'll want to check the patient's charts as well as MD orders. Check for allergies, code status, diet, and bathroom privileges, such as if they use a urinal, a bedpan, a Foley catheter, or the toilet itself. Also check for isolation precautions and gather the necessary equipment, falls risk, and aspiration precautions. Also check the patient's turn schedule and IV solution and rate, and also gather necessary equipment. Check for the patient's cultural and religious considerations. When entering a patient's room, take a visual snapshot of the patient themselves and conduct hand hygiene.
Patient is lying in bed, resting, no signs of distress noted. Good morning, ma'am. How are you doing today?
I'm good. How are you?
I'm good. Thank you so much for asking. My name is Private First Class Swift. If you could, please just verify your name and date of birth for me.
Abigail Bond, and February 7, 2006.
Do you have any food or drug allergies that you know of?
Latex and sulfur.
Okay. All right. Thank you very much. Like I said, my name is Private First Class Swift. I'm going to be your LPN student today. Today we're going to be doing a full head-to-toe assessment. Is that okay with you?
Mm-hmm.
Okay. So first I'm going to start with some questions. If you could, please just tell me where we are right now.
The hospital.
And could you tell me the date?
November 14th.
All right. And would you please tell me why you are here?
Just a well check.
Patient is A&O times 4. All right, before we get started, I just have a few questions to ask. First, do you feel as though your cultural and religious needs are being met, such as foods that you can't eat, prayer times, or the need to speak to a chaplain?
Yes.
And do you feel as though you have a support system at home? This could be children, spouse, neighbors, or friends.
Yes.
Okay. And do you have any thoughts of harming yourselves or others?
No.
Is English your preferred language?
Mm-hmm.
Okay. All right, ma'am, we're going to start out by getting your vital signs first. Could I see your arm, please?
Mm-hmm.
Thank you. Perfect. Can I see your other hand, please? Thank you. All right, I'm going to stick this temperature probe under your tongue. Could you open up for me? Thank you. And I'm just going to check your pulse with this hand, okay?
Mm-hmm.
Although I told the patient that I'm checking her pulse, I'm actually using this time to count her respirations and monitor the rise and fall of her chest.
Before checking the patient's blood pressure, you want to make sure you find the brachial pulse and line it up with the index marker. Take your fingers, feel the pulsation. Where you feel that, line up the marker, and when you put on the blood pressure cuff, you want to make sure it's not too tight or not too loose.
We're done with your vital signs. On a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain imaginable, could you please tell me what level of pain you are feeling today?
0.
All right, thank you. And do you currently experience any numbness, tingling, or tremors?
No.
Thank you. All right, ma'am, we're going to move on to the next part of your head-to-toe assessment. This part does require me to touch you. Is that okay?
Mm-hmm.
All right, I'm going to begin by touching your head. Is there anything that I might feel when I touch your scalp?
No.
Okay. Do you feel any pain or discomfort with this, ma'am?
No.
All right. Any pain or discomfort with that?
No.
All right, ma'am, do you experience any hearing difficulties?
No.
Any use of a hearing aid?
Mm-mm.
All right, I'm just going to take a look inside of your ears. If you could please just turn your head to the left for me. All right, I'm going to check your other ear. Please turn your head to the right. And you can go ahead and look for it. Thank you. Lateral range of motion in the neck is present. There are no excess serum or fluids coming from the patient's ears. All right, ma'am, we're going to do a very small hearing test. If you could just tell me which ear you hear this sound coming out of, okay?
Okay. Right. Left. Both.
Patient's hearing is bilaterally intact. Do you wear any glasses or contacts?
No.
Do you have any blurry vision or do you experience any vision loss?
No.
And do you have any ocular implants?
No.
If you could please just follow my pen with your eyes and your eyes only. Thank you. Patient's extraocular movements are intact. All right, ma'am, if you could just look up for me, I'm just going to check the constriction of your pupils. Patient's right pupil constricts from 4 millimeters to 3 millimeters. Patient's left pupil constricts from 4 millimeters to 3 millimeters. Patient's pupils are equal, round, reactive to light, and accommodating. Are you currently experiencing any congestion?
No.
I'm going to cover one of your nostrils, and then I just need you to inhale, and then we'll repeat the same with the other nostril, okay?
Okay.
Okay. Patient's nares are patent. All right, ma'am, if you could please just look up for me. Patient has no signs of septal deviation. All right, ma'am, I'm just going to touch your face, okay?
Okay.
Okay. Any pain or discomfort with that?
No.
All right, ma'am, could you look up for me? I'm just going to pull down on your cheek. Thank you. Patient's sclera is white and the patient's conjunctiva is pink and moist. Please open your mouth for me. The mucous membranes are pink and moist. The gums are pink and moist. The teeth have no cracks or breaks. And the lips are pink and moist. Thank you. For the next part of this assessment, I'm going to expose your chest. Patient has no scars, wounds, and is not on telemetry. Patient's skin is non-tinting. Now I'm going to palpate your chest. Any pain or discomfort with that, ma'am?
No.
Any pain or discomfort with that, ma'am?
No.
Perfect. Are you currently experiencing any coughs?
No.
All right. I'm just going to listen to your chest. Would you please sit up for me? Thank you. Ma'am, will you feel my stethoscope touch your chest? Please just take an inhale for me, okay?
Mm-hmm.
Thank you, ma'am. Before you auscultate the lung sounds on the back, you want to first inspect the patient's back. You want to look at the skin and assess the spine for kyphosis, lordosis, or scoliosis. After you've inspected the patient's back, locate the scapula, as these will determine where you will be listening. All right, ma'am, when you feel my stethoscope touch your back, please take an inhale in for me. Patient's lung sounds are clear. The patient's chest rise and falls is equal bilaterally, and the patient shows no use of accessory muscles. S1 and S2 heard, no murmurs noted.
To assess the patient's heart sounds, begin on their right side and identify their clavicle, and go to the second intercostal space to start off with your aortic valve. Move over to the left side, second intercostal space, for the pulmonic valve. Third intercostal space, left of the sternum, is Erb's point. Fourth intercostal space is the tricuspid valve. And fifth intercostal space, midclavicular line, is the mitral valve. Here is where you want to listen for the apical pulse for 60 full seconds.
All right, ma'am, now we're going to start with your GI assessment. If you could, please tell me any special diets that you are on.
I rarely eat red meat.
Okay, and when was the last time that you ate?
This morning.
And could you give me a number percentage of how much of that food that you ate?
100%.
Okay, and when you use the bathroom, do you use a bedpan, a commode, or do you actually go to the bathroom?
I walk to the bathroom.
Okay, thank you. And when was your last bowel movement?
This morning.
This morning? Okay. And are you able to pass gas?
Yes.
Okay. And when was the last time that you urinated?
This morning.
Okay, could you tell me the amount?
Normal amount.
Okay. And what was the color?
It was pale yellow.
Okay. Were there any odors?
No.
Did you notice any sediments or particles when you urinated?
No.
Okay. Was that clear or cloudy?
It was clear.
Okay. Do you experience any urgency, frequency, or pain when urinating?
No.
Okay. And when was your last menstrual period?
It was 2 weeks ago.
Okay. And do you have any abnormal vaginal discharge?
No.
Thank you. All right, ma'am, we're going to move forward with your GI assessment. First, I'm going to inspect the abdomen. The patient's abdomen is flat and round. There are no ostomies or wounds. Now I'm going to divide the patient's abdomen into 4 quadrants by locating her umbilicus. And then I'm going to auscultate each quadrant for 1 full minute and hope to hear 4 to 32 sounds. This is the patient's left upper quadrant. This is the patient's right upper quadrant. This is the patient's left lower quadrant. And this is the patient's right lower quadrant. Vowel sounds are normal active in all 4 quadrants. Next, we're going to palpate. Any pain or discomfort with that, ma'am?
No.
Any pain or discomfort with that, ma'am? No mass is noted. The patient's abdomen is soft. At this time, do you have to use the bathroom, ma'am?
No.
Okay. Locate the patient's symphysis pubis and palpate the bladder. Any pain or discomfort with that, ma'am?
No.
Okay. No distension of the bladder is noted.
When palpating and auscultating the patient's abdomen, identify their rib cage as well as their pelvic bone, ensuring to palpate lightly, avoiding bony prominences.
All right, ma'am. Now we're going to do some range of motion for the upper extremities. Before we get started, do you have any numbness, tingling, or tremors of the upper extremities?
No.
Perfect. Go ahead and repeat after me. Bring your arms up like this. Can you flip them over? And bring your elbows in. Extend them for me, please. Will you twirl your wrists? And can you wiggle your fingers? Perfect. You can go ahead and relax. Now we're going to do some passive range of motion. I'm just going to move your arms. Go ahead and relax with me, please, okay?
Okay.
Do you feel any pain or discomfort with this, ma'am?
No.
Okay. Patient's skin is warm, dry, and intact with muscle tone. At this time, if the patient has an IV, go ahead and inspect the IV for patency and inspect for any signs of infection. When you're checking for pitting edema, make sure you're pressing on a bony prominence for 3 seconds. No pitting edema noted. Also assess for range of motion in the wrist. Any pain or discomfort with that, ma'am?
No.
And assess for range of motion with the fingers as well. Range of motion is present in the fingers, and hair distribution is equal for the right upper extremity. For cap refill, the refill time should be less than 3 seconds. Now you're going to assess the patient's fingernails for any thickening or abnormal coloring. Patient's fingernails show no sign of thickening or abnormal colors. All right, ma'am, if you could just squeeze my fingers as tight as you can. Equal bilateral grip strength. Now you're going to assess the patient's radial pulse. Patient's pulse is +3, equal bilateral. Assess the cap refill for the other extremity as well. Patient's capillary refill is less than 3 seconds.
When assessing the nail, you want to look at the color, you want to assess for thickness, and you also want to make sure that it's clear. When you are checking for capillary refill, you want to take 1 digit, press down, and release. Once it releases, you would like for your capillary refill to be between 1 to 3 seconds.
You're going to repeat assessing the range of motion for the fingers as well as the wrist. And you're going to check for pitting edema on this extremity as well. No pitting edema and full range of motion. Patient has full range of motion. The skin is warm, dry, and intact with equal hair distribution, and the patient has adequate muscle tone. Did you feel any pain or discomfort with that, ma'am?
No.
Excellent. All right, ma'am, we're going to get started with some range of motion for the lower extremities. Do you have any numbness, tingling, or tremors of the lower extremities?
No.
Okay. I'm going to do some movements with my legs, and I just need you to copy me, okay?
Okay.
Perfect. Can you bring your leg up like this? Can you pull your leg in for me? Can you bring your leg back out? Will you twirl out the ankle? And then wiggle your toes? All right, great. You can relax. Now I'm going to do some passive range of motion. I'm going to touch your leg, okay?
Okay.
Any pain or discomfort with this?
No.
Okay. Any pain or discomfort with this?
No.
All right. Patient's skin is warm, dry, and intact with even hair distribution and muscle tone. Patient has no pitting edema for the lower right extremity. Full range of motion in the ankle. Full range of motion in the toes. Patient's pedal pulses are +2, equal bilaterally. The patient's toenails show no signs of abnormal coloring or thickening. Ma'am, can you push down on my hand for me, please? And can you push upwards on my hand for me, please? Patient has equal bilateral strength in the feet.
When assessing the lower extremities, you want to check for capillary refills. You do this by pressing on the nail beds, and capillary refill should be less than 3 seconds. While you're assessing the lower extremities, look at the toenails looking for discoloration or thickness of the nails. Also, when assessing the lower extremities, we need to check a pedal pulse. And also, we're going to be checking for edema in the lower extremities.
Any pain or discomfort with this, ma'am?
No.
Excellent. The patient's skin is warm, dry, and intact with muscle tone and even hair distribution. All right, ma'am. At this time, I'm gonna just have you take a short walk so that we can assess your walking ability. Are you comfortable with that?
Yes.
Okay. Can you sit up in bed for me? And go ahead and swing your legs off the edge of the bed. Any dizziness with that?
No.
Okay. And do you use any walkers or walking aids?
No.
Okay. Whenever you're ready, just go ahead and stand up and I'll be here to assist you. Any dizziness with that?
No.
Okay. We're going to go on a very short walk, just take a couple of steps this way. Okay, go ahead and turn. And let's head back to the bed. Okay, you can go ahead and turn around. And then go ahead and back up onto the bed until you feel your calves touch the side. And whenever you're ready, go ahead and have a seat. Did you experience any pain or discomfort when walking?
No.
Any dizziness at all?
No.
Okay, thank you. The patient ambulates without assistance, has no lip, and has a steady gait. Before you end your assessment, assure that the side rails are up by 2 and that the bed is locked in the lowest position possible. Always provide discharge teaching and instruct the patient on how to access the call light if need be. Ma'am, thank you so much for your time today. Is there anything else that I can do for you?
No, thank you.
Thank you very much. Always thank the patient for their time.
Ms. Bell,